Dr. David. Welcome to tonight's presentation on hormone balance and breast health. And actually, Jackie and I were talking about this, and we were like, well, this is Breast Cancer Month. We probably should have titled it Hormone Balance and Breast Cancer. But I guess Jackie was trying to be politically correct. So here we go, and here we are. Those of you joining us for the first time, this is a presentation that is in line with what we've been doing, and our goal is to provide you with the best and the most useful information concerning your health. The truth is, you really can't find all the answers by watching TV, and even in your doctor's office, you don't find all the answers because it's only from one perspective, and that's from the conventional allopathic medicine approach. And of course, nothing wrong with that. However, medicine and health have a much bigger picture. Besides, your doctor only has a few minutes with you anyway, so he can't explain everything you need to know about breast cancer, for instance. And that's why we have these webinars to go in depth into what you need to know about how to take care or take control of your health. And we've been doing this now for about three to 4 years, actually going on 4 years. And Jackie has played a very key role in all this, and we are so grateful to have her working side by side with us in educating people around the world. Without much further ado, I'm going to hand this over to Jackie. We're going to say quickly that Jackie is known for her Let's Talk About Hormones conferences and seminars that she does all over North America. She has a wonderful approach to hormonal health, a very common sense approach, a very scientific approach. And by the way, we've had some of our gynecologists and other people who deal with hormone health who have listened to our presentations, and they've said, absolutely, this makes a lot of sense. So you're not just listening to a layperson, although she is a layperson. You are listening to someone who has done her research, who has studied under some of the best people in the field, and who has been able to break things down in a way that the layperson can understand. And I think that's what we need in this day and age. Without much further ado, I'm saying that for the second time, I'm going to hand this over to Jackie. And Jackie, thank you again for all you do.
Well, thank you, David. I certainly appreciate the opportunity to be able to communicate what I think is a very important message. And I love this vehicle of being able to share this information on Building Strength webinars. I really do appreciate all the work that you do, and I hope that people understand that there are many speakers on Building Strength webinars who are more than worthy of our paying attention to. So but I do appreciate this opportunity. Thanks, David.
You bet. Thank you.
All right, I'm going to get started because we have a lot of information to present here. And so what I'd like to do is, first of all, just introduce myself a little bit to those of you who do not know me well. I was trained and mentored by Dr. John Lee. I met him back in 1993, and he encouraged me to begin sharing this from a layperson's perspective. And just meeting Dr. Lee has changed my life. I want you to know. So we want to approach hormonal balance with a goal to prevention of breast cancer. Some facts that you might find, a little bit of astounding, but breast cancer is the second leading cause of death. It's most common cancer in North America. And believe it or not, the incidence of breast cancer increases as women age. All women are at risk, and even there are some men who are at risk. We'll address a little bit of that tonight as well. 1 out of 8 women will be diagnosed with breast cancer. So, if you have a circle of friends, just know that it's becoming more and more common. In fact, I rarely meet a woman who does not have a friend or a relative who has not encountered breast cancer. Do you know that 20 years ago when I started sharing this, that was not true? And so the increase in breast cancer amongst women over 50 is really actually quite dramatic. So in relationship to breast cancer being, with October being Breast Cancer Awareness Month, we're going to talk about the effect that hormones have on breast tissue and ultimately on breast health, and I call that Hormones 101. Testing for hormonal balance, because I believe that it's better to test and not guess when it comes to hormones, and if your hormones are have gone awry, then that's the place to start in a prevention program. And then we'll talk about restoring hormonal balance, and I'll outline a 5-step program that can be useful. You know, balanced hormones are important. They're actually a key to optimum health and wellness. I believe that education and tools that are out there available for most women and men, it will help them to achieve hormonal balance. You know, truthfully, breast health for many women is determined by the absence of breast cancer. So if we don't have breast cancer, we must have healthy breast tissue. But healthy breast tissue doesn't have cysts. Healthy breast tissue is not lumpy, nor is it dense. Healthy breast tissue is soft and not painful to touch. And you know, when we combine all of that, then the symptoms that I just mentioned would be signs of a hormone imbalance that is reflected in breast tissue. So why do we want healthy breast tissue? Well, in a word, we want to practice a form of prevention. And something else to learn is that male breast cancer is on the rise. Now, you know, I know that we will have very few men on this call tonight, and I understand that. But breast cancer in men is on the rise, and so I think it behooves the caregivers, that's often the women in the men's lives, to keep on top of the issue of male breast cancer. You know, men's breast cancer, although it accounts for less than 1% of all breast cancer, the fact is that it's increased by 26% since 1973. So, you know, that's a real serious cause for concern. Breast cancer tumors in men tend to be detected later in life simply because they're not aggressively approaching it as women are. And so there was a study done at the University of Texas in the MD Anderson Cancer Center that indicates that excess estrogen is the primary culprit in men's breast cancer as well. And, you know, tonight after our presentation, you'll realize that breast cancer in women is attributed to elevated levels of estrogen and unopposed by adequate progesterone. Well, it will be the same thing for men. The strongest risk factor for men developing breast cancer will be obesity, same with women, lack of exercise, same with women, which causes our cells to overproduce estrogen. Unfortunately, enlargement of the breasts, they call it gynecomastia, should be taken as a symptom of a hormone imbalance, and most specifically excess estrogen, because, again, the enlargement of the breasts for a man are a sign of a hormone imbalance. Well, we at Help for Hormones really believe that balanced hormones are the key. We want everyone on this call to understand what we're looking at here, so let's take a look at Hormones 101. First of all of our hormones are produced from the building block cholesterol. Now, I think that for some on this call, particularly if you're new to our calls, that may come as a surprise. I personally believe that cholesterol is getting kind of a bad rap. Having too much cholesterol certainly can increase our risk for heart disease if it occludes the arteries, but it's also dangerous to have too little cholesterol. In fact, without cholesterol, we would not be able to live. But certainly without an adequate amount of cholesterol, we cannot produce the hormones that our body necessarily needs to produce. Weightlifting can help lower your cholesterol. Load up your fork with vegetables and lift it to your mouth. Do 3 sets, 15 reps daily. This is a great thing to remember. This would be a better approach to balancing cholesterol levels in your body than for many of us to go on cholesterol-lowering statin drugs, which often take our hormone levels way too low, so low that then hormonal balance or imbalance becomes an issue. All right, from cholesterol, pregnenolone is produced. You know, cholesterol is first synthesized into this kind of precursor catalyst form. adding pregnenolone has not proven to elevate progesterone levels, so we believe that it is just a catalyst. We expect to see more studies on this, but we'll wait and see. However, what we do know is that in the pathway for steroid hormone production, progesterone then is the next hormone in this pathway. Progesterone gets its name because it is the progestation hormone. It's the hormone that is necessary to maintain a pregnancy, for instance. We know that women who have developed problems at the beginning of their pregnancy with things like nausea, that often we look at low progesterone stores for causing nausea at the beginning of pregnancy. We also look at the end of a pregnancy, and a woman should be producing 300 to 400 milligrams of progesterone. If she's not, then what can happen is her low progesterone stores can cause preterm babies, so babies that are born prematurely. We also know after the delivery that if she has low progesterone, then she could easily develop postpartum depression or baby blues. It was Dr. Katerina Dalton that determined that, checking out the progesterone levels in women with postpartum depression and baby blues and even preterm babies was advantageous, because if it was low progesterone, that was an easy thing to resolve, and we'll talk about that a little bit later. So progesterone is the hormone that protects our breast tissue from estrogen excess, or what we today refer to as estrogen dominance. And that is the key take-home message tonight about progesterone. Progesterone needs to be an adequate supply to protect your tissue and my breast tissue from estrogen, excess estrogen, or to keep it from estrogen dominance. Now, estrogen dominance, just so you know, right out of at the beginning of this presentation, Dr. Lee coined that term, and it's related to a deficiency of progesterone and the level of estrogen that's in a woman's body. So it is a relative term. The amount of estrogen will determine how much progesterone you need. And of course, let's realize that a menstruating woman should have more estrogen than a non-menstruating woman, so a menstruating woman should have more progesterone than a non-menstruating woman. Symptomatically, estrogen dominance can manifest itself as irregular periods, water retention, breast tenderness, forgetfulness, foggy thinking, mood swings, and depression. Without progesterone supplementation, I'm pretty convinced that women will likely experience estrogen dominance at whatever point their estrogen-progesterone relationship goes out of balance. And we tend to see this, I've been doing this, as David said, for 20 years. We've been testing for more than 15, and we see this commonly with women who contact us. Now, it's important to note the relationship between adrenal hormones and progesterone. Progesterone is a precursor to cortisol. Cortisol is the hormone that is produced when we are under stress. In fact, it's the hormone that keeps us level when we're under stress. And I probably should ask everyone on the call, how's your stress level? If you are overstressed, your body, your adrenals kick in. They produce more cholesterol or cortisol, and they grab any progesterone that's available to produce that cortisol. We call that a progesterone steal. So I think of cortisol and progesterone as a backup energy system. What would happen if you didn't have enough progesterone? Well, then the adrenals are scrambling. They don't have enough resources to produce an adequate amount of cortisol, and so the adrenals tend to falter and fail, and we see adrenal fatigue begin to happen. So when women are under stress, their body needs to make more cortisol just to keep them afloat on a daily basis. That means that the adrenals need to kick in and produce that extra bit. They need to have progesterone in place. I'm not going to spend a lot of time on androstenedione and testosterone in the whole breast cancer picture, but the reason why I would mention testosterone here is because when it's the main producer of estrogen in menopausal women. Testosterone is converted to estrogen in menopausal women. And I think that it's important to note that what we're seeing in saliva testing is elevated testosterone in women over 50. And that elevated testosterone means that too much testosterone can convert to estrogen. And we're going to see that reflected with estrogen-dominant women as well. From testosterone, from androstenedione, are produced the 3 forms of estrogen. And isn't it interesting that our estrogen is, when it's not produced in the ovaries, as it is in menstruating women, when it's produced in a menopausal woman, this is how it's produced. And there are 3 forms of estrogen, actually, E1, E2, and E3 estrogen. Each one of them has a role to play, but you'll notice the little arrows. E1 and E2 go back and forth between each other. Estrone is produced in the fat cells from androstenedione. E2 estrogen is produced from testosterone converting under the influence of aromatase enzymes. And both of those 2 estrogens are considered very powerful and would be considered cancer-causing estrogens. Now, notice E3 estrogen with the arrow going down. There's no arrow going back up. E3 estrogen is really considered one of the safest forms of estrogen for a woman to use if she is somewhat estrogen deficient. It does not appear that this form of estrogen goes back up and becomes one of the stronger 2 estrogens that could cause cancer. So the idea is that estriol is known as a weak cancer or weak estrogen, and its weakness is likely its strength. Research suggests then that estriol has benefits for bone density, for heart health, for MS, for postmenopausal urinary tract health, etc. So this would be the better form to use. There are 3 ways that our body produces estrogen. And I think it's important to note that the ovaries produce estrogen forever. It's just that ovarian production of estrogen is at its highest when a woman is menstruating and ovulating. The supplemental or auxiliary system is the adrenals for changing testosterone and androstenedione into estrone and estradiol. Small amounts of estrogen are normally produced by the adrenals, depending on the health of the adrenals. Look at the 3rd way, though. Our adipose, or fat tissue, is the main way that our body is producing estrogen. And actually, Dr. Lee used to say that we needed to, at menopause, increase our body fat by about 10 pounds in order to have this take place, because the ovaries and the adrenals have to have body fat in order to operate most effectively, particularly the adrenals in producing a little bit of estrogen. So he was not strongly in favor of menopausal women becoming extremely slender at menopause. He felt that 10 pounds excess body fat was necessary for the production of estrogen. This is E1 estrogen. Again, estrone is made in the body from androstenedione. That was diagrammed on the pathway. Estradiol, very strong estrogen again. It's made from E1 estrogen, and it's also made from testosterone. E3, very weak estrogen. Research shows that it's very helpful. It can be very helpful and does some of the same things that the stronger estrogens do without the concern of cancer, particularly breast cancer, ovarian or uterine cancer. Now let's talk about progesterone. Progesterone is the balancing hormone to estrogen. Dr. Lee talked about it as the hormone that was necessary when a woman became estrogen dominant. The ovaries, when a woman ovulates, of course, they release an egg. The place where the egg is released is called the corpus luteum. That is where progesterone is produced in a woman who's menstruating and ovulating. But you know, every woman who's listening is going to stop menstruating and ovulating, and then that means that the production for progesterone is going to be turned over to the adrenals. So the adrenals are supposed to pick up the function. What I have discovered is that women are so stressed that their adrenal function is relatively low, and they're not producing very much progesterone in with their adrenals. They're mainly producing cortisol just to keep their life afloat. The brain will also produce small amounts of progesterone, but very small amounts, and of course the brain relies on progesterone to be present. Adipose tissue does not make any progesterone, and so progesterone stores tend to be relatively depleted. Progesterone slows normal and abnormal cell growth while balancing the effects of estrogen. And this is, in a nutshell, why becoming progesterone deficient for breast health is not a good place to be. The study was done at Johns Hopkins Medical School, revealed that women with progesterone deficiency were 5.4 times more likely to have breast cancer prior to menopause. Now, this study clearly illustrates that breast cancer is associated with a progesterone deficiency. Those women would not have been ovulating. They may have been menstruating, but they likely weren't ovulating because, remember, prior to menopause, the main way a woman produces progesterone is through the ovulatory pathway. After menopause, we rely on our adrenals, and that's where stress can come in. If a woman is under stress, her body, her adrenals, take progesterone away from balancing with estrogen and convert it to production of cortisol. And this is one of the mechanisms that I believe are evident in women who develop breast cancer. Often the question is asked, have you been through a stressful situation? Or you can look back, you know, in the last year or two, were you under a significant amount of stress? That will have an impact on your hormone health always. All right, Provera is not progesterone. I think it's important to recognize that progesterone, synthetically derived, doesn't do the same things as the body or bioidentical progesterone. Provera is a synthetic progestin. And look at the side effects. The top side effect is that it increases the risk of breast cancer. What we have to recognize, when we take synthetic hormones into our body, they actually blockade our own body's ability to produce that same hormone. And again, the synthetic hormones don't do what the natural hormones do, and so synthetics often cause more problems than perhaps they are worth. I talked to a woman today who was put on Provera to stop bleeding. Well, I'm going to suggest that using a synthetic certainly will stop bleeding, but using a natural bioidentical progesterone would do the same thing and wouldn't have the side effects that are listed here. All right, so when we see estrogen dominance, when we see an imbalance of hormones, when are we seeing that come to be? Well, we're seeing it at almost every stage in a woman's life. There isn't a stage on this page where women's hormones cannot become imbalanced. You know, beginning at adolescence, if a young girl doesn't ovulate every cycle, she's not going to produce progesterone. If she's a little bit overweight, she's going to overproduce estrogen. There begins an imbalance. Beginning in the mid-30s, for a premenopausal woman, if her ovary function begins to decline, she's going to experience decreased levels of estrogen progesterone. There begins estrogen dominance. And I think, you know, as a perimenopausal woman goes into that stage before menopause, there's about a 5-year time frame where her menstrual cycles are irregular and her production of hormones is irregular. Dr. Pryor says that she can produce as much as 30% more estrogen in this time frame, and yet her progesterone may have dropped 90%. In fact, that's almost into the basement. In the perimenopausal time, we see huge fluctuations in hormones and see a dramatic occurrence of estrogen dominance. And then on into menopause, when hormone levels normally should decrease, we see elevated estrogen, we see progesterone absolutely almost non-existent, and you know, creating this hormonal imbalance. And what women tend to do is they tend to use estrogenics to try to solve the issues. And I'm going to suggest here tonight that eating foods that are made or that are created and that are estrogenic, strongly estrogenic, is not the solution. Let's talk about some of the symptoms that women are evidencing with estrogen dominance. PMS, of course, for young women, the adolescent woman, the premenopausal, and even the perimenopausal woman, PMS seems to come back with a vengeance, are all connected to estrogen dominance. In fact, Dr. Pryor says that all PMS, Dr. Pryor is an endocrinologist at the University of British Columbia. She's quoted in John Lee's book, what your doctor may not tell you about menopause. And her take on PMS is that it is always associated with estrogen dominance. Foggy thinking, irritability, memory loss. These are 3 symptoms that are created because of estrogen excess and a deficiency of progesterone. Do you know people who suffer from foggy thinking, irritability, or memory loss? And if you're one of them, you probably don't remember. However, foggy thinking, irritability, and memory loss are attributed as a symptom of estrogen dominance. Too much estrogen, not enough progesterone. Balance needs to come into place to resolve this. Fibrocystic breast disease, uterine fibroids, and ovarian cysts are all evidence of estrogen dominance. Remember the role of estrogen in a woman's body. It is to grow, multiply, and divide cells. What are cysts? They are cells that have grown and multiplied and divided. Now, this isn't rocket science, ladies and gentlemen. Basically, when you have too much estrogen proliferating too many cells, then we're going to have cysts dramatically throughout the body, not just in the breast tissue, on the uterus, and on the ovaries. Dr. Fleckus is one of the team of gentlemen, physicians, who is in the iodine group. And he suggests that breast tissue has an affinity for iodine. We'll be talking about iodine a little bit later, but he says iodine deficiency often causes fibrocystic breast disease with nodules, with cyst enlargement, with pain, and with scar tissue. Fibrocystic breast disease, he says, is characterized by lumpy, painful breasts, generally in reproductive aged women. Initially, this syndrome occurred in premenstrual phase of a cycle or involves the whole cycle. He says that these symptoms can occur in menopausal women who are put on estrogen therapy. In other words, estrogen is a key factor here, but he suggests that a deficiency of iodine may be a connection. So we'll come back to that, and we'll talk about iodine insufficiency before the call is finished. Depression is a symptom of estrogen dominance. You know, women experiencing depression roughly double the rate of men. That in and of itself really points to the fact that there's a hormone connection. The burden of depression may be shifting to women even younger than 45. So that also points to the fact that hormones are going out of balance younger and younger. A German study showed that the largest number of receptors for progesterone were located in the brain. So if a woman were to become progesterone deficient, either as a menstruating woman or as a menopausal woman, then depression could be the result. Low progesterone then may be a contributing factor to depression and anxiety in these women. You know, there have been a number of studies that have shown a lot of promise in supporting the fact that giving women and men who have brain damage progesterone early, using it as a tool to generally enhance brain health, seems to be coming into being. So there are new studies all the time, and there was a research paper published that focused primarily on the effects on blunt traumatic brain injury and strokes, and there was lots of evidence to show that it was very effective. So we know that progesterone has a significantly positive effect on the brain. Decreased sex drive is a symptom of estrogen dominance. And I think what tends to happen here is we tend to think of low libido or decreased sex drive as primarily sitting at the feet of testosterone, low testosterone. And when we evaluate women's hormones, we often find that they have elevated testosterone. Dr. Lee said right from the beginning that he believed that the hormone that rises or peaks at ovulation is progesterone. And when women are progesterone deprived or progesterone deficient, that's when their sex drive is more likely to be low. So more likely progesterone deficiency than testosterone deficiency. Certainly that's worth checking out. I'm not going to deal much with bone loss or osteoporosis, just to note that it too is a sign of estrogen dominance. Dr. Pryor's comment, we need all three hormones in order to produce and to maintain good quality bone. We need adequate estrogen, we need adequate progesterone, we need adequate testosterone. I'll come back to that another time. We'll delve into the wheres and whys of osteoporosis as it is connected to hormone imbalance. But just note that if you know someone who's developed osteopenia or osteoporosis, chances are their hormones are out of balance and they should likely evaluate their hormone levels. Now, another symptom of estrogen dominance is low-functioning thyroid, and it also seems to or appears to have a connection with healthy breast tissue as well. This is a little bit of a test that I use at my live seminars, and if you can just go through and answer any of these questions with a yes, there's a good chance that your thyroid isn't working optimally. So some key signs are fatigue. Extreme fatigue often starts out with fatigue in the evening, but it becomes fatigue in the morning and then ultimately fatigue all day. Cold hands and cold feet would be a sign. Brain fog certainly is a sign. A difficulty losing weight, being constipated, anyone developing PMS, all could be evidence of a low-functioning thyroid. This is what happens in the thyroid hormone pathway, and particularly if you go to your doctor, they will test the TSH level. TSH is thyroid-stimulating hormone and is produced from a signal from the brain. The brain sends the signal, and thyroid-stimulating hormone is produced, telling the thyroid to kick in and produce T4 hormone. Now, T4 is inactive hormone. It has to convert to T3 to be active. If your TSH is very high, your doctor will recommend supplementation with T4, usually. So when you go to your doctor, they will test if you have the symptoms that were indicated on that test, then they'll test the TSH level. If it's too high, they'll put you on thyroxine or levothyroxine. What they're assuming is that your body is automatically going to convert the T4 to T3. Here's what we know. If your body is not capable of converting T4 to T3, then you will maintain hypothyroid or underactive thyroid symptoms regardless of the drug that you were given. And I meet many women who tell me, when I was given thyroxine, it didn't make any difference. Nothing changed for me. Now, again, it has to convert to T3. T3 is needed for fat loss. T3 is needed to protect against heartbeat irregularities. T3 is necessary for a balanced mood. T3 is necessary for cholesterol regulation. And T3 is necessary in the hormone cascade to keep breast tissue healthy. What is the problem then? Well, in low amounts of iodine are usually responsible for the inability of T4 to convert to T3. Insufficient iodine. We've heard a lot about iodine when we heard about the Japan reactors emitting radioactive iodine. The thought there was, well, if you don't have enough iodine in your body, it will very readily absorb the radioactive iodine. Well, we believe that for breast health, it's important to have an adequate amount of iodine or sufficient amount of iodine so that your thyroid can function properly and convert T4 to T3 so that you can feel healthy and well. Studies have shown that if you don't have enough iodine, there's enough evidence to say that fibrocystic breast disease could result, and in fact, increasing your iodine stores has shown a reversal in fibrocystic breast disease. But it has reversed all of the symptoms that are shown as iodine insufficiency symptoms. Interesting to note how closely connected low thyroid symptoms are with low iodine. What about specifically iodine and our breast tissue? Well, the evidence is out there that iodine can accomplish the following. It can desensitize estrogen receptors in the breast. So if you are a person who is overproducing, whether you're a man or a woman, overproducing estrogen in your breast tissue, your prostate tissue, wherever, then and it's reflected in lumpy, cysty breasts, then iodine may be too low in your body. It can reduce estrogen production in overactive ovaries. It can reduce fibrocystic breast disease, which often precedes breast cancer. It's the scary thing about lumpy breasts. And it causes apoptosis, which is cell death, and which is necessary to happen. Cancer is cells not dying. Apoptosis is cell death. And so iodine supports normal cell death that should be taking place in the body. Dr. David Derry is a Canadian doctor who is focused on iodine and breast cancer. He's written a very thought-provoking and theoretical book based on clinical practice titled Breast Cancer and Iodine, How to Prevent and How to Survive Breast Cancer. Dr. Derry is also a guest on Mary Solomon's about.com website, and I have spoken with him. He's a very credible medical doctor and believes with all his heart that iodine deficiency is one component that women with breast cancer should look at. So there is a test for iodine insufficiency, and I really encourage any woman who has cysty breasts, any woman who has a history of breast cancer in her family, any woman who has a concern, any man who has a history of breast cancer in his family or who has developed gynecomastia, enlarged breasts. He should be testing, all of those folks should be testing for iodine on a regular basis, making sure when you test for insufficiency that you then go on a program to remediate if your iodine stores are low. And I'll be very honest, I've done about, 500 to 1,000 iodine tests from people all over North America, and we have yet to find anyone who had normal iodine results without supplementation first. You can obtain an iodine insufficiency test from Help for Hormones. There's actually a really good newsletter on that website. If you go into the section on iodine testing far enough, you'll be able to obtain a very excellent newsletter that will on iodine testing. All right, so in review, the symptoms of estrogen imbalance: PMS, foggy thinking, irritability, memory loss, fibrocystic breast, or any cysts in the body, depression, decreased sex drive, bone loss, thyroid dysfunction, are all symptoms of a hormone imbalance. What is the cause then? What is the bottom line cause for this? Well, insufficient production of progesterone to protect our tissues from estrogen excess. Overproduction of the two forms of estrogen that are considered carcinogenic. Insulin resistance, taking in too many refined carbs or too many carbs at the expense of proteins and fats, raises our testosterone level as women, lowers testosterone as men, and puts us at risk for estrogen dominance. Stress, because of the progesterone steal that accompanies elevated cortisol. A lack of good nutrition, a lack of a high-fiber diet. In fact, we know that insulin resistance could be nipped in the bud simply by improving fiber intake. Too many chemicals and pollutants in our environment that are estrogenic or xenoestrogenic, as we say. Those same estrogens or anti-estrogens can block hormone receptors, and they can be a contributing factor. Conventional hormone replacement therapy and birth control pills both give a woman too many hormones. The historical perspective on medical options is basically this. All doctors had to give us for the last 50 years to resolve our hormone issues were estrogen combined with the synthetic progestin, which was synthetic, and birth control pills. All three of these have been problematic. When you look at the history, I look at the 202 WHI trial halted due to increased risk of stroke, heart attack, and breast cancer. All those years of giving women hormones resulted still in overdosing us on hormones that we probably didn't need, and in the end, increasing our risk for cancer. Just to review, there were 16,600 healthy women in the WHI study. After 5 years of being on HRT, the women developed a 41% increase in stroke, 29% increase in heart attacks, 213% increase in blood clots, and the straw that broke the camel's back caused the study to be stopped 2 years early was the 26% increase in breast cancer. So hormone replacement therapy of a synthetic variety is not the answer for women. The invasive breast cancer risk of 26%, I just personally do not believe that we can or should even have access to a drug that can cause invasive breast cancer or that can cause heart disease. And it's interesting to me because I'm of the age of women who were offered this hormone replacement therapy, Premarin and Provera, or estrogen and a synthetic progestin. And I was offered it to prevent heart disease. Now that certainly has changed. No one is out there saying that it prevents heart disease, and everyone knows it will increase our risk for stroke. The main problem with HRT, well, Premarin has 15% horse's urine in it, and so those contain estrogens that are more potent than anything found in our body. In other words, Premarin wasn't a bioidentical hormone. It was bioidentical to a horse, but not to a human. Provera, on the other hand, is dramatically synthetic. It is a synthetic form of progesterone so that the manufacturers could patent it, and it has 150 listed side effects. The combination together caused tremendous problems. What about the pill? Well, the birth control pill has its own set of problems. All birth control pills today contain similar hormones to HRT. Now, think about it. The only difference is they often have higher amounts, similar and in higher amounts. All birth control pills work by stopping ovulation. Well, that's the process of production of progesterone for a young woman. Here we're going to put them on the pill and stop the production of progesterone. That's definitely going to increase their risk for estrogen dominance. All birth control pills have no therapeutic benefit that outweighs their risks. They were not created as a medicine, and so their risks, when you take them, they have similar risks to most medicines. There's a secondary side effect. Well, the secondary side effect for the birth control pill is, number one, decreased libido. That seems crazy. You're on the pill to have unlimited sexual intercourse, and the want to goes away. A risk for stroke, a high risk for stroke, a high risk for depression. How many women are on the birth control pill and on an antidepressant? Migraine headaches, and then ultimately breast cancer. In the media this month, I've observed more people pointing to birth control pills as a significant risk factor for breast cancer than I've ever seen. And I think we're going to start to see that escalate. Well, what is the solution then? How do we, you and I, bring hormonal balance, combat estrogen dominance so that we can produce healthy breast tissue? Well, education is the key. Watch our DVD. We have a DVD that's listed on our Help for Hormones website. It goes into this in a lot more detail. I believe that education is the key to our power. If we understand the why things are happening, we'll know what to do. And that's the premise of the DVD, Let's Talk About Hormones. Once we've educated ourselves, we've got newsletters, we've got a number of things. Come onto our website, ask for more information. We'd be glad to help you. Then step 2 is to evaluate our hormones. Evaluation for us means saliva testing. Dr. J. Mead at Labrix says this about saliva testing. He is a physician, he's a pathologist. With saliva, it's possible to get a good measure of the amount of hormones actually available to the tissues. This is termed bioavailable. This is because the hormones have to pass through the tissue in the mouth to get into saliva. Hormones in blood are often bound to proteins and may or may not be available to tissues. In fact, we now know that about 98% of hormones circulating in your bloodstream and mine are bound to protein and will never get into receptor sites. So there's only about 2% of the hormones in our bloodstream that are actually unbound and available to receptor sites. So when women and men do blood tests for estrogen and progesterone particularly, often it doesn't give the best picture. Women will come back saying, well, my doctor told me that my hormones are normal, but the blood test showed that, but I really don't feel like I'm normal. Why would a person do a saliva test? Well, if you think your symptoms are related to a hormone imbalance, women and men both are very intuitive, women particularly, and good on the pickup on this. So you will intuitively know whether or not a test is the right place to start for you. Is a hormone deficiency causing your osteoporosis? For anyone diagnosed with osteoporosis or osteopenia, they should be checking out all three of their hormones, estrogen, progesterone, testosterone, and should probably be doing it annually. If you need a balancing program, is breast health a concern? Do you have fibrocystic breasts? Are you exhibiting some of the symptoms that are connected to an imbalance of hormones? If that is the case, then you need a balancing program. Always, we encourage you to start with a saliva test. If you're currently on a program, whether it contains HRT or whether it is a bioidentical program, you should be testing on a regular basis. We encourage evaluation annually, as you would with a medical checkup. And men, again, to determine their risk for prostate disease, and because tonight's call is about breast cancer, they should do a test to determine where's my estrogen, where is my testosterone, do I have enough protection from progesterone to prevent any breast cancer from happening for me. So what hormones do I test? Well, we have 3 tests that we offer on our website. We have a 2-panel test, which offers 2 hormones to test, a 3-panel test, which tests estrogen, progesterone, and testosterone. That would be for a man or for a woman who's been diagnosed with osteoporosis. The 2-panel test would test estrogen dominance. A 5-panel test would be used if you think stress is involved. What we would like to see then is what your morning cortisol and your DHEA are doing to see where your adrenal function would lie. It's very easy to do a test. Basically, there are 4 small tubes about the size of your baby finger. You would spit into a tube before breakfast, before lunch, before dinner, before bedtime. Snap the lid closed and make sure you hear the snap. Put it in the prepaid mailer envelope, mail it off to the lab. Now, if you live in Canada or outside of the United States, then you have to pay for the mailing. The results are emailed to you within 7 days of the lab receiving the sample. So the lab needs to have it for 7 days. You have to take into consideration mailing. I want to just talk a bit about mammography versus thermography. I know that regular mammography from starting at age 40 is being encouraged in the United States. And, you know, there doesn't seem to be a lot of evidence to support that this is a worthwhile endeavor. There is a place for a mammogram, but remember, mammograms irradiate your breast. When we go to the dentist, we usually put a shield over our breast just for the amount of radiation we're going to get from an x-ray of our teeth. Why would we consistently x-ray our breasts if there is nothing to x-ray, no lump there? The time to do mammography is if a lump is detected. So, you know, keep that in mind. Dr. Lee once said that if a woman from 50 to 65 did a mammogram every year, she could actually develop mammogram-induced breast cancer. We actually are adherents of thermography. Thermography detects a heat change in the breast tissue. And the detection of heat in the breast tissue indicates that there could be some structural changes or lumps. And this detection can take place sometimes as long as 10 years before anything is detected by mammography. It's safe even for young women, and it's safe to do it for over a long period of time. So if you don't have an actual lump, thermography is the better way to go. Doing your clinical breast exam with your physician once every year is very important, I believe, for menopausal women, every 3 years for women who are younger. Doing your own breast self-exam, I think, is very important as well. Understanding and realizing that you need to be as familiar with your breast tissue so that you can tell if you have a lump or not. All right, so let's talk about solutions to a hormone imbalance. Education and evaluation are two of the main things, but then we have to do something with that information. If you just educate yourself, if you just evaluate your hormone levels, that's not going to resolve any hormone imbalance that you might have. You still have to embark on a program to balance your hormones. Dr. Lee always taught we work on two fronts. If you're estrogen dominant, you want to bring your estrogen down, modulate it with a nutritional program. You want to bring your progesterone up, and we know that there's nothing you and I can eat that will improve our progesterone levels. So basically, balancing hormones means to deal with estrogen, deal with progesterone. Let's talk about progesterone and the criteria for a progesterone cream. And this became important because in visiting with Dr. Lee, he told me that everyone out there is making a progesterone product. It's sold over the counter in the United States, and how can you tell whether a cream is going to work or not? He said, well, some of these criteria would be helpful to most women. 400 to 500 milligrams of USP-grade progesterone per ounce. So if you have a 2-ounce tube, you want to have that doubled, about 1,000 milligrams. The average person will dose between 20 and 40 milligrams in a divided dose, half in the morning and half at night. The reason we use this amount is because that's what a woman's body makes. When she's menstruating, she makes about 40 milligrams a day. When she's not menstruating, she makes about 20. We apply it to the areas on our body where the skin is thinnest, and there are a variety of places. And we cycle progesterone. Everyone takes at least a week off. Menstruating women take 2 weeks off. We have excellent handouts. If women go on a program with those of us that are Help for Hormones consultants, Max Alive consultants, we have wonderful information. In fact, I tell women, don't buy a progesterone product unless you get an adequate amount of information. You should receive a document that tells you the profile, what's in that cream. You should receive a document from that manufacturer on how to use that cream. We send a document on expectations and how to get the most from your cream. So the more information you have, progesterone is a hormone, the better you are. When bioidentical progesterone balances estrogen dominance and turns off the cell growth mechanism, it can have a cancer-preventing effect, says Dr. Randolph from Florida. Dr. Dalton, Katarina Dalton, says we use progesterone instead of estrogen replacement. Most women don't need any estrogen, and we found that to be true as well. Progesterone alone will do it. What about progesterone in women? Well, progesterone in women helps to prevent cancer of the uterus because cancer in the uterus is estrogen-driven, and so progesterone balances with the estrogen. It helps to protect the breast because it opposes estrogen in the breast tissue. It increases bone density because progesterone is the bone-building hormone. Estrogen slows up the breaking down of old bone, but it is progesterone that is the bone-building hormone. And it has a tremendous effect on the skin and on prevention of endometriosis. Even the elderly can use progesterone. And, you know, I've used progesterone with my mom, who's 92. And when I asked Dr. Lee, at what age should you stop using progesterone, he says, well, I used to say 96, I now say 98. So that tells me that progesterone is intended to be used long-term. What does progesterone do? It does a lot of things. I mean, I couldn't even get into all of the things that progesterone does. And we have a book list at the end of this presentation that I'll put up on the screen. Dr. Lee's books are really valuable. Dr. Taylor has been traveling around the country. He's an OBGYN, and he has been expounding on the virtues of bioidentical hormones. And he really believes that studies have shown that natural progesterone applied to the skin will alleviate menopausal symptoms in 83% of women. And we have seen that as well. Partly because it opposes estrogen, but it does a lot of other things as well. One of the things that I noticed when I first started using progesterone, I lost 20 pounds of body fat, and that was when I was in my 40s. I started using progesterone as a perimenopausal woman. Dr. Lee says this: there are some things that you and I need to know about progesterone. Number one, you only would use any bioidentical hormone, estrogen, progesterone, testosterone, if you truly are deficient. How do you find that out? You do a saliva test first. We believe test, don't guess. And then if your test result comes back and says you're deficient in progesterone, then use a bioidentical form. If it says you're deficient in estrogen or testosterone, again, use only bioidentical forms. Bioidentical meaning manufactured in such a way that it exactly matches what your body and mind produces. And then use only doses that match what is normally found in body tissues. I just mentioned that normally a menopausal woman uses about 20 milligrams of progesterone in a day. So dosing with 20 is more than sufficient. Men, on the other hand, use somewhere between 5 and 10 milligrams of progesterone. So dosing a 5 to 10 milligram dose with a man would be very appropriate. And progesterone for men can help to influence prostate disease. Our balancing program always starts with good nutrition. We believe that eating 40-30-30 is the way to begin any program. So start your program with a good nutrition perspective, and this book is outstanding. If you'll be able to pick it up on Amazon.com. Excellent, excellent book. 40% carbs, 30% protein, 30% essential fats. Eating in balance does two things. Number one, it helps your body and mind produce hormones for the rest of our lives. And number two, it will prevent insulin resistance that leads to diabetes. Eating correctly is the key to modulating and stabilizing our estrogen. When we add to that an increase in fiber, the 40% carbs are vegetables, fruit, and whole grains. They need to be high fiber choices. Our goal is to get our fiber intake between 30 and 50 grams per day. Break it down by meal, about 15 grams of fiber per meal. That's appropriate. Why? Because a higher intake of dietary fiber is associated with lower circulating estrogen levels. What fiber does is it binds to the metabolites in any hormone that's circulating in excess in our bloodstream. So it doesn't take out hormones that are in our receptor sites already. It just binds to estrogen, testosterone, hormones that are in excess in our bloodstream. So we are advocates of improving our fiber intake. Number two, increase water and exercise. Both of these two things also affect the eliminative pathway for getting rid of excess hormones. Fiber affects the bowel, water affects the kidneys, and exercise affects our ability to perspire. All three of those are eliminative pathways where if we become estrogen excess, then we can get rid of that estrogen. If we become testosterone excessive, then we can get rid of that testosterone. Doing these two things, very, very important. Next is to increase our vitamin C, and particularly in an ascorbate form. When people are under stress or experiencing adrenal fatigue, their body's need for vitamin C increases dramatically. When delivered in an ascorbate form, it's one of the easiest forms for the body to assimilate and use, says Dr. James Wilson. And we concur. When people are under stress, it's important to increase the vitamin C intake in their diet. And again, if you use an ascorbic acid product, that would be like eating 60 oranges a day. Dr. Wilson's recommendation is 3 grams of an ascorbate form of vitamin C per day. Well, that's, if you took it as ascorbic, you shouldn't take more than 500 milligrams, and then you're not going to get the same effect of adrenal support. So this is strictly vitamin C to support the adrenals. Next, to increase the indoles in your diet. Indole 3-carbinol is the active ingredient in cruciferous vegetables like broccoli and cauliflower, cabbage, and kale. Indole 3-carbinol has tremendous ability to modulate estrogen levels, and it helps our body eliminate excess estrogen or xenoestrogens via the liver. I encourage women to be on an indole 3-carbinol supplement on an ongoing basis, simply because of the environmental xenoestrogens and the estrogens that are found in our food. I3C increases the good estrogen. It inhibits bad estrogen. It protects estrogen-dominant cancers, including breast, prostate, cervical cancer. I3C in combination with tamoxifen works, but it is more effective than tamoxifen alone. So, and for all the women that have periods, flooding, ovarian cysts, endometriosis, fibroids, acne, it stops all of that. So I heartily encourage women to do two things. Number one, eat more cruciferous vegetables, but the studies showed that we needed to eat 3 pounds a day, which is onerous for most of us. And so there are supplements out there. We've actually created an excellent supplement that is available that has twice the ingredients of most of the products on the market. Use a fruit and vegetable concentrate to compensate for nutritional gaps in the diet. You know, most of us just don't eat enough good food. We're always concerned about our weight, but researchers have found that women who ate large quantities of fruit had a 35% increase, lower risk of developing breast cancer. Now, the problem with eating large quantities of fruit is going to be the influx of sugar that happens when we eat fruit, and again, the spike in insulin. So eating a fruit and vegetable concentrate that doesn't have the calories but has the nutrition would be an optimal way to improve this. Use a moderate amount of calcium. The studies out today are showing 250 milligrams of calcium in a bioavailable form, preferably from a plant, and increase your vitamin D3 is better than taking in 1,000 milligrams of calcium. Now, the premise here is that we are all eating well, and from your existing diet, you can get about 1,000 milligrams of calcium. So basically, supplementation, all it needs to be is about 250 milligrams of calcium. The downside of over-supplementing calcium is bone spurs and kidney stones. But increasing vitamin D3 helps with the absorption, and so that needs to take place as well. There's a connection with D3 and hormones. And there's a shift going on, Dr. Northrup says, amongst researchers, where a few years ago they said the range of 20 to 100. Now they're saying, you know, it was raised 32. Dr. Cannell, John Cannell, is saying 40 to 80 is the range that they like to see vitamin D3 stores in. And vitamin D3 is the natural human form, so it needs to have a 3 after it. It's the form of vitamin D that's made on your skin from cholesterol. Again, to make an adequate amount of D3, we need enough cholesterol in our body because that's the reaction with sunlight that takes place. The sun shines on our skin, connects with the cholesterol in our body, and manufactures vitamin D. Don't confuse D3 with D2, which may be found in small amounts in the multivitamins. D3 is what you're looking for. Low levels of D3 have not proven effective in many studies using vitamin D therapeutically. So keeping the levels higher, above, well, normally what they're saying now is 2,000 IUs on a daily basis. There is a connection, apparently, between vitamin D and breast cancer, and what they're seeing out there is they're testing women who are breast cancer patients, and they're seeing that they don't have many vitamin D receptors. But if they give them vitamin D3, they increase the number of D3 receptors. And D3 is highly protective of cancer. It does matter where we live. Latitude does count. The women in the sunniest regions of the U.S. had about half as likely to die from breast cancer as were women who lived in the less sunny regions. So there's the line above Los Angeles, above Columbia. Basically, we see the need for more exposure to the sun and certainly more supplementation with vitamin D, possibly more testing. Breast cancer patients with low vitamin D levels had a 73% higher risk of death than women who were vitamin D deficient. And remember, this is vitamin D3. Here's another study. Getting no less than 1,000 international units of vitamin D, and now they're saying 3,000 to 5,000 units. Everyone on this call should at some point in the fall do a vitamin D3 test. After the summer is when you test your vitamin D3 levels to find out whether or not you have assimilated enough vitamin D and stored it in your system for duration over the winter. Now is the best time to test for vitamin D3. If your vitamin D3 test comes back and you're deficient or insufficient, then just know that you're going to have to supplement. I know that I talked to a woman the other day who said that she had a vitamin D test, and she was shocked at how low her vitamin D level was, and she's outside a lot. So we agree with Dr. Christine Northrup. We encourage every woman at this time of year, and probably every man as well, to check their vitamin D3 levels. There's the gauge. If you look, the Canadian representation is on the right, the American is on the left, and basically we want to see 60 and above, and with the Canadians 150 and above. If you want a copy of this gauge, that's available in our vitamin D3 newsletter on our website, helpforhormones.com. Just go into the D3 testing until you get to where that newsletter is, and you can print that off and you'll have a copy of that gauge. All right, let's review. This is not a difficult thing to do. Modulating and stabilizing your estrogen is real important. Fiber, vitamin C, indoles, a fruit and vegetable concentrate, and calcium. And actually, we put the indoles, a fruit and vegetable calcium concentrate, calcium, and D3 into one supplement. Hormonally challenged women don't like to do tons, and if you're interested in that, this is where you can obtain that. Go to www.maxalive.com and have a look at the supplements that are there. Daily Max is a supplement that has the indoles in it. Body Max is the progesterone cream, and C Max is the vitamin C. Fiber Max is the fiber. Have a look. These are excellent supplements. They are made to go along with this program. In our 5-step program, these are the things that we have set out to do. Number 1, do a saliva test. We provide a free review with every test kit that's purchased from us. You either meet with one of our consultants or with myself. If you mention that you were on this webinar, then for sure we will make sure that one of the consultants addresses your issues personally with you once you get your test results back. Then we encourage you to purchase the book, the formula. At the very least, get on track with your nutrition. Most people that are on these calls have a very good nutrition program. It just needs to be tweaked. A sign that you're not eating 30-30-30, a sign that the last meal, the previous meal, was not balanced would be sugar cravings. Supplement the difference in your diet with fiber, vitamin C, indoles, calcium, fruit and vegetable, D3 together are in one supplement for us, one called Daily Max, and iodine as needed. Exercise to maintain testosterone levels and to eliminate fat and to reduce estrogen levels. We believe estrogen can be a stress reliever and a detoxer. Important to maintain exercise protocol. And then last but not least, use bioidentical hormones. And that's only to be used, you know, when you see that you have a deficiency. When we accept responsibility for the health decisions that we have made in the past and begin to take responsibility for our own current hormone health, you know, that's when we move forward to wellness. And we all want to achieve wellness, that's for sure. Making sure that we are healthy and well is an important part of what we're talking about. And breast health is important. We believe in maximizing your life. When we decided what to name our supplement company, I asked the question, how do women and men want to feel? Well, we want to feel at our maximum. So maximize your health. Balance your hormones, and you won't ever have to worry about breast health. The DVD is important if you're interested in more information about this. We have newsletters. We have a variety of information that we can send you. We're always looking for Max Alive consultants. And so if you are a person who is a practitioner out there, if you're a person who wants to become a health advocate for balancing hormones, if you have a practice and want a hormone perspective, we educate and train consultants on an ongoing basis. Email me at helpforhormones@gmail.com. I would love to visit with you and work this through. with you and help you to become productive in the area of becoming a consultant with Max Alive and sharing this important message with others. I'm going to open up the lines to some questions now. So if you are interested in some questions, you can type them in. I'm sure that there's some things there that you can have a note to see. I see there aren't any questions right now. This is the seminar reading list. And we can give you a copy of this if you would like. I wanted to show you the reference list that I used. These are all the references. And that was fairly lengthy reference list. And so just note that there's lots of background and support for this information. All right, at this point, there's no one that's come forward with any questions. Oh, thank you for the kind comments. I appreciate any and all comments. Is there anyone else out there that would like to type in a question and have me answer? All right. Well, I haven't eaten my dinner tonight, so I'm going to have dinner. I thank you all very much for being on this call. I thank Dr. David again. If you are interested in more information, he has lots and lots of information out there. So thank you so very much again, and I trust that we will be able to talk to you. Yes?
Thank you. Appreciate you. But the couple of questions have come in. It looks like some people just figured out how to type in their questions.
Oh, there you go. All right. I didn't pick up on that, so I'll put it out again. I didn't want to collapse the call too quickly. Okay, just a second now. Which test should a person have first? Of the 3 tests, the saliva test is probably the most important. I think that starting with the saliva test, probably an iodine test would be after that, and usually the lab will suggest whether or not an iodine test is warranted, and I just tell everyone to do D3 tests at this time of the year. I hope that answers your question. When is my next webinar? Carol. Well, we haven't, you know, Dr. David has asked if I would come on once a month, but I'm not able to do that. I'm not sure. We haven't discussed that. I'd like to do another one on men's health for sure coming up. And heart health month is February, and I usually like to do something on hormones and heart health because a lot of people don't realize that there is a connection. So we'll think about something for men and perhaps something for heart health for February. Dr. David will like that.
Oh yeah,
all right.
Absolutely.
Motivation from the outside, right?
Well, Jackie, like you said, we would love you to do one every day.
Oh, well, that's a little bit much. All right. All right, another question. Can you overdose on progesterone? You know, that's a great question. Using Provera, you could. So if you're using a synthetic progestin, absolutely. Using bioidentical progesterone, when a woman is pregnant, her body makes up to 400 milligrams, or equivalent to about half a tube of progesterone. So we have not found any women that have OD'd on it. In fact, I was doing a radio show down in western Washington State, and the doctor I was interviewing told me that she had taken her progesterone to her massage therapist and had him apply half a tube of progesterone. She said all that happened was that her libido increased. So I, you know, take that for what it is, Patricia. I hope that answers. All right. Where can I get a copy of the German study on depression anxiety? I type in progesterone and German study and see if you can get something that way. If you've been diagnosed with prostate cancer, would it benefit from a saliva test? Absolutely. Any man who has prostate cancer usually has elevated estrogen. And so if you have the diagnosis of prostate cancer, you want to lower your estrogen, you want to bring up your progesterone, you want to, you know, make sure that you do all that you can for, you know, as a part of the protocol for prostate cancer. And certainly the indole supplement, real important as well. How do you feel about using HCG dieting for dieting when it's so hard for a woman to lose weight? I'm a pretty strong proponent of using HCG. I think it probably is one of the best ways for a woman or a man to diet. Anything that I've read, and I've read Dr. Simeon's protocol, and from what I can understand, if you have abnormally placed body fat that should not be in that spot, HCG will work very well for you. I'm a very strong advocate of it. I've also had a woman who told me that she used HCG because in Dr. Lee's book, he mentions that it can be a protocol for breast cancer. You can look into that. If you want more information on HCG, by all means, email me and I can provide you with some good information on it.
A quick question about on HCG. One of the problems that we've seen, Jackie, and I assume, and I know you probably have a good answer for that, but this is that people go on HCG, they lose weight, but then they, because the diet and the requirements are so harsh, they gain that weight soon afterwards. It's like the rebound even sometimes is worse than it was at the beginning.
And I would absolutely agree. I think that any diet, any change in your normal nutrition is a diet, okay, if you're lowering the calories. And you always have to be thinking ahead of what I'm going to do when I get off of this. Now, I personally have lost weight on HCG, and I am the exact weight that I was a month ago when I was dieting. Now, how do I do that? Well, I didn't go back and eat the same way. I made some corrections. And what I find with people, make some serious corrections. For instance, for me, I know that grains are problematic for me. And so I stay away from all grains and focus on vegetables and fruit, protein, good quality protein, organic preferably, and essential fats. And when I do that and combine it with some exercise, I'm able to maintain my weight. So, you know, I think that to use HCG to lose a bunch of weight and then go back to eat the way you were, that's not going to fly. But it wouldn't fly with any diet, would it, David?
Absolutely not. Absolutely not. Yeah. Well, that makes sense. So,
and you know, in every program, Weight Watchers, Sure Slim, every program that's out there, people gain the weight back. Jenny Craig, I mean, you name it, people lose it and gain it back. So it's not just HCG.
Well, that is true, but HCG has one of the fastest weight loss programs there because it works so quickly, and that's probably where the problem is, because it works so quickly, people don't
adjust,
have the discipline to switch their diet the way you've just described.
Right. So, you know, one of the things to think about is to very slowly increase the carbs. You know, when I come off of it, you know, doing a 6 or even an 8-week maintenance, you know, it's so delightful to be able to eat some of those other foods that I'm very happy just eating from a wider variety, but staying within the same parameter, not the same calories, though. You have to increase the calories. I have a gal, Charlotte, on the call. She's done HCG and kept it off for 3 years. So she says follow the protocol.
Well, she's probably working with someone who really knows what he or she is doing.
Well, she's helped over 40 women, probably closer to 50 or 60 women, lose weight. But she says that you have to be diligent. Once you come off, you can't just let it go. But you know, I find that you know, if I add appropriate, because on HCG you're not supposed to really exercise, and I like working out in the gym and I like gardening, and so I find when I work out, then that seems to work. Somebody's asking the question, what is HCG? It's human chorionic gonadotropin, and it's a hormone that seems to precipitate weight loss. What it does is it mobilizes body fat, and it's probably one of the safer ways to lose weight. There are two ways to ingest HCG. One is by injection from a prescription usually with a doctor. Another way would be to take homeopathic drops. I personally use the injection because I have a physician who's very much on board with this, but I know people that have successfully lost with the drops as well. You have to be disciplined, and I think that weight loss is, in the end, all about discipline. For those of us that have gained weight, I know I didn't gain weight till after menopause. And so for me, you know, weight gain has been, you know, a relatively new thing. So, you know, I don't identify with women who say I have had weight issues all my life, but I've talked to women who have had weight issues all their lives, and for them, HCG was the answer, amazingly enough. The other difference between the shots and the drops you can continue until your weight is gone. The shots are only for 6 weeks, and then you have to stop. Your body becomes conditioned to it. I think we should drop the HCG thing. Let's go on to some of these other things. Another question. Okay, would men and women be able to go off statin drugs if they went on this program? It's work at the reverse. They should work with their doctor to go off statin drugs. Statin drugs are suppressing their cholesterol, and so they have to do other things in place of statin drugs to lower their cholesterol into whatever range. Now, you know, again, I'm not a proponent strongly with the American cholesterol norms. You know, I like to see my cholesterol between 200 and 300. And certainly lower, or you know, maybe a little bit higher than what the Canadian standards are as well. It is the pharmaceutical companies that have been pushing to lower the statins, or lower the cholesterol with statin drugs. But again, we don't want to get ourselves into a position where our cholesterol is so low that it's harming our hormones. So a person on statin drugs should do a saliva test first. See if it's lowering or causing their hormones to bottom out. If it is, then they should have a discussion with the physician about what they can do as an alternative. And, you know, exercise, good nutrition, all help to lower cholesterol levels. I believe in working with their physician. So, you know, whoever prescribed it, get them on board to say, hey, I want to get off these drugs. What do I have to do that? All right, another question. My daughter has HPV, and during pregnancy, it is in remission. Would progesterone help because now it's back? You know, she should do a saliva test, and there is evidence that there is a contributing factor with low progesterone. Progesterone helps support the immune system as well, and so if she consistently has low progesterone, it could be a factor. She would have to do a test to find that out. Does being slim increase the chance of being estrogen dominant? No, being slim, well, one way or the other. You could and you couldn't. What we have found is that weight issues don't seem to be a tremendous influence. I've seen women who work out in the gym. They're very slender, very lean, very high estrogen, and their progesterone levels are in the basement. So the best thing to do is to evaluate your hormone levels and find out, all right? Are you estrogen dominant? Are you not? The lab will give you the diagnosis, and you know, that will solve that problem. If you are given the diagnosis of estrogen dominance, then from our program tonight, you know how to work. I can connect you with one of our consultants. By all means, you know, I encourage you to move forward with that. But weight issues, one way or the other, well, we have women that are estrogen dominant on both sides of the fence. Women that are overweight, women that are very slender, and women that don't have weight issues. So I can honestly say that's probably not an indicator. How often should a person do a saliva test? That's a great question. I have really encourage the women that I serve to do a saliva test once every year with your medical. As a menopausal woman, I'm keeping tabs on my hormones. That's what I'm using it for. I don't want elevated estrogen. I want progesterone because I'm on a progesterone cream. I want to make sure that my progesterone is where it should be for bone density issues and for brain issues. And then lastly, I want my testosterone to stay where it's in a healthy range, not to be elevated, and which would be an indicator of insulin resistance. I also, because I help hormonally challenged women, want to make sure that my stress isn't overtaking my life. You know, in addition, some of you don't know, but I have 7 children. Now, they're all out of the home, but you know what that's like. That just means I take on all of their car payments and house payments as in addition to all the good things that I have going on in my life, helping hormonally challenged men and women. So I just want to make sure that I'm on top of the game. And so we do both my husband and I do a saliva test every year, just with our medical. But we did one and resolved the issues and did a second one. So usually most people are going to do one and do another one within 6 months to a year to make sure you get a good test result from whatever protocol that you decide to go on. All right. Any other questions out there? These are good. Can I get a copy? Oh yeah, the German study. I'm just I don't have an access to that. So I'll you know, if you email me, I'll try. I could probably get you a copy, but you can Google it. Everything is on the net these days, especially studies. Lots of studies. All right. I think I'm weary and well doing. David, what do you think?
I think you've done very, very well, Jackie, as always.
All right. Well, I think we should say goodnight. But thanks again, David. You know, I very much believe in what you're doing, and I trust that, you know, every person on this call will take a look at some of the other excellent presenters. He has Dr. Barry Sears. I mean, awesome, awesome presenters on here. So Dr. Barry Sears is the inventor of the zone 40-30-30. To get a chance to listen to him, he's more than worthwhile.
Yeah, he's really great.
Very excellent.
Yeah, yeah.
Okay, you know, I have one more question. Can a woman with stage 3 cancer do this? A woman with stage 3 cancer, you know what I've learned? I've learned that you can have cancer at every stage and still survive. So what's to not start on a program? There was an oncologist in British Columbia who commented to his cancer patient who was on our program, who said, this is one of the best programs I've seen. You know, we're talking nutrition, we're talking exercise. What's to not do about this? We're talking about some supplementation and an evaluation tool. What's to not do about it? All right, with that comment, I think we're going to say goodnight. Thanks so much, David.
Jackie, thank you so, so much. Great job. Appreciate you. All right. And thank you, folks, for joining us. Actually, Bernie Siegel is going to be on next week to talk about miracles. And he's a surgeon who has been working with patients, now cancer patients especially, and he has his own nonprofit organization where he helps people with cancer. And he's a legend in the whole field of health and wellness. So be sure to be on it next week at this time, this day, Thursday. God bless. You guys have a great evening and good weekend too.